wanted to do is we have essential caregivers here from around the country, and we want to educate everybody on why this issue is important, what is an essential caregiver, what did essential caregiving look like before the pandemic, what did it look like during the pandemic, and what changes we need to make as a result of a lot of what everyone's experiences here exposed. And we held a great press conference this morning to raise awareness. This is a bipartisan bill with 12 co-sponsors, I think, that we've added. So momentum is building, and this is, we want this to continue to be a bipartisan effort. And so I'll just, a few quick things just about the bill, and then what we're going to do is we're going to turn it over to the panelists here. They're going to share a little bit about their own experiences, and then I hope we can have a really good discussion after and help answer any questions that you may have. So really briefly, a recent study found that individuals who are lonely are at 59% greater risk of physical or mental decline and a 45% greater risk of death. And I think everybody here can tell you that they know this all too well. And so we're here today because over the course of the past year, seniors, children, those with intellectual disabilities, and others in long-term care facilities suffered alone in isolation. The caregivers here today from every corner of the nation, actually, were cut off from their loved ones, forced to communicate over FaceTime or through a window for months on end. The separation caused already vulnerable populations to suffer even more. And that's why we've introduced H.R. 3733, the Essential Caregivers Act. This bill would create an essential caregiver program that would be applicable in any future public health emergency and would apply to any long-term care facility that receives federal funding through CMS. Under the program, residents in these facilities will have the right to designate up to 2 essential caregivers who would be permitted to access the residence. This means that family members and loved ones would be allowed to enter facilities in the future to provide care and support that their family members and residents have come to rely on. Importantly, the bill upholds strict safety and health standards to protect residents, staff, and caregivers, and I think this is important. And as you'll hear from the panelists, nobody cares more about the life, well-being, safety of the residents than the caregivers. And so making sure that everybody is safe, that testing, PPE, whatever precautions need to be taken are taken is a priority. So the individuals here today will tell you why this bill is so important to them. And I think as you'll hear, they'll make the point that essential caregivers are not just visitors. As the name implies, they're caregivers. They help with activities of daily living, they provide emotional support and companionship, and this care really truly enriches the lives of residents and enhances their well-being and helps them thrive physically, emotionally, and socially. Without it, residents ultimately suffer, and you'll also hear about that today too. So with that, I don't want to drone on any longer. I think we'll get to the program, and Mairead, we're still waiting for her. So we'll turn it over to Toby Edelman, and I'll just read a quick bio. So Toby has been a steadfast force working to advance the rights of long-term care residents since 1977. She's been the senior policy attorney with the Center for Medicare Advocacy since January 2000. Ms. Edelman was the lead attorney for a statewide class of nursing facility residents who successfully challenged the state of California's refusal to implement the federal nursing home reform law. As a beneficiary representative, Ms. Edelman has testified before Congress and served on federal task forces in the past, technical expert panels, and working groups on nursing home issues. So Ms. Edelman, we're really happy to have you here today, and I'll turn the floor over to you.
Thank you. Well, before I start, I just want to say I'm really humbled and honored to be in your presence because I think you have done something quite extraordinary. And I think the advocates can learn a lot from what the essential caregiving families have done. The federal nursing home reform law, which was passed by Congress in 1987, gives residents the right to immediate access, quote, to immediate family and other relatives 24 hours a day, 7 days a week, as well as immediate access to anyone else they want to see. Families are critical to the operation of nursing homes. They participate in assessment and care planning, help provide direct care to their loved one, provide important emotional support, and inform staff of issues and problems. The public oversight system also relies on families to talk with state surveyors and to file complaints with the State Department of Health or the federal government as needed. Many family complaints alert government officials to the most serious problems in nursing homes. Everything changed in March 2020 when the public health emergency was announced. For the first time, families were absolutely and completely barred. Although the federal government lifted the ban a year later in March 2021, we know that the ban on families continues in far too many facilities in practice. Many facilities, even now, continue to limit the frequency and duration of visits, telling families they can visit for 40 minutes once or twice a week and not at all on weekends. While limitations on who could come into facilities may have made some sense at the beginning of the pandemic, when little was known about COVID and how it spread, these limitations have made less and less sense over time as we learn more about coronavirus and how to protect against it, and especially as vaccines became available. We also know that families were needed more than ever during the pandemic. Insufficient staffing levels, always a problem at nursing homes, became more serious and more pervasive during the pandemic as staff members themselves became sick and left their jobs. New staff, often aides hired without sufficient training, and agency staff did not know the residents or how to take care of them properly. But one of the most serious consequences of the ban, we now know, is that residents suffered tremendously from social isolation, loneliness, and neglect. As families have begun to see their relatives in person, they've reported enormous physical and mental declines. Multiple reports from government agencies and elsewhere tell the same story over and over, and the stories told at this morning's press conference were powerful and devastating. Last fall, the Associated Press reported, quote, "For every 2 COVID-19 victims in long-term care, there is another who died prematurely of other causes," close quote. This nursing home expert, consulted by the Associated Press, estimated back in the fall that there have been 40,000 what he called excess deaths since March 2020. Surveys of residents and some surveys of family members as well, reported by Human Rights Watch, the consulting group Alterum, and the National Consumer Voice for Quality Long-Term Care, the National Advocacy Organization for Residents, and other witnesses all describe the social isolation and loneliness of residents and the resulting physical and mental decline and failure to thrive. Consumer Voice and other advocates for residents have called for a full restoration of visitation in nursing homes now, and full restoration of rights is obviously key. But what happens in the next public health emergency? The Essential Caregivers Act of 2021 says unequivocally that we cannot ever again totally ban families. Regardless of any public health emergency, the bill guarantees that all residents can choose up to 2 people as essential caregivers to provide them with assistance 12 hours each day and for an unlimited number of hours at the end of a resident's life. The legislation is critical for residents and their families, and we at the Center for Medicare Advocacy strongly support its enactment, and will do what we can to help sure it becomes law. Thank you.
Thank you. And what we'll do is we'll go through and have all the panelists present their brief opening remarks, and then we'll open it up to questions. So next is Karla Abraham-Conley. And Karla is, like myself, a resident of New York's 22nd Congressional District. And when my boss, Claudia Tenney, was sworn in about 100 days late due to the recount in all these election issues, the first issue that she said we're going to work on is the Essential Caregivers Act. And ever since then, I haven't been able to get Karla to stop calling me and today. So briefly, Karla works in finance in the banking industry and leads New York Caregivers for Compromise and advocates for COVID nursing home residents, with a combined membership of over 2,000 families and residents. Karla, locally in New York, has worked with Assemblywoman Marian Buttonshaw, Senator Rachel May, and others to write and pass S-614B in March, which was New York's version of the Essential Caregiver Bill. Karla has been the advocacy lead working with Congresswoman Claudia Tenney's office to help develop HR 3733 in conjunction with leaders of long-term care resident advocacy groups from across the country. And most of you are here today too, so thank you for that. Karla?
Thank you, Nick. This too is quite an honor, so thank you everybody for being here and allowing us to share our stories, as sad as they are. I think I was born an essential caregiver. It's kind of my nature. I just take care of people. This one affected my mother, and I put her in a home to save her life. She was no longer safe at home. Had I known COVID was coming, I probably would have just quit my job and taken care of her, and she would have been alive. So I put her in a home. It was not the right thing to do. And who would have known within 6 months COVID was gonna hit, lock us out, and I got to watch my mother deteriorate day by day via FaceTime. Horrible way to watch the person who gave you birth and taught you right from wrong and gave you the morals to just become nothing. So I fought, and I fought back. And I knew my law. I'm not a healthcare person. I'm a banker. But I know my New York State laws when it comes to health. And the nursing homes decided that they too knew them, and they didn't. Compassionate care and end of life to them were the same. They are not. My mother would 100% still be alive today had I been allowed in. When I finally got to my mother on September 27th, after a 7-hour fight to get her to an emergency room, my mother had black teeth. Black. She had a pressure ulcer, stage 3, infected, filled with sepsis, severe dehydration, malnourishment, renal failure, and swelling of the brain due to the sodium levels from lack of hydration. I had 7 days left with my mother in comfort care. And I will tell you, I brushed my mother's teeth every hour, very gently. On the 3rd day, my mother had her whiteys back. Okay? My mother, who became nonverbal from no communication, no one to speak to her, no one to engage her, held my hand and looked at me and went, "Hi." Last words I ever heard from my mother. She died October 4th. Holding my hand, I never left her side. So hospice allowed me there 24 hours a day for 7 solid days. I slept in bed with my mother, holding her, as my mother would have done for me had I been a sick child. My passion for this became even more as she passed. And I fought with a group of women and one man, Charlie, that got me, understood it, because they too were living it. Maybe their story was a little different than mine, but the end result was the same. They're not able to go in. We have a woman who is struggling that her father is being beat up every day in his nursing home. She can't get. We're not in a pandemic anymore. Okay, we understood the lockout in the beginning. Especially with everybody being short-staffed in these homes. Why would you deny me, you, everybody here that is an essential caregiver, to get in there and help feed your loved one, or just brush their teeth? Talk to them, touch them. How long could you think you could really live without the human touch? And you guys are all healthy. I give you 2 months before you're going home to your mom and say, "Geez, I just need a hug." Because it's going to happen. We're human. So our rights were taken away in a way that blinded all of us. Nobody kind of knew really what was going on. Our country let us down, and it is time for us to stand behind what we poured our heart and soul into these last several months of writing this bill, making sure that it was just where it needed to be, because every one of you in this entire country is affected by this bill. You will all get old. You may all give birth to a child who needs a long-term care facility. Do you not want to see your kid? this is where I'm coming from. People ask me every day, how are you doing this? Your mother's dead, how are you going on? My mother did raise somebody to stand back and go, okay, you're dead, I'm done. No. My mother speaks through me, I think, because I'm probably not going to remember anything I said. This is the most important bill, in my opinion, for the rest of everybody's life and for the future, your children's future. It 100% needs to be passed. We had 170,000 more deaths in nursing homes last year, not COVID related. Not COVID. We won't even go with the COVID because that was a whole, we all know what happened there. I hope that I get everybody's support. I would like the entire Congress to sign on and sponsor this bill because it affects all of us. Thank you. Thanks, next. I'm gonna text you later.
I'm still not telling her where I live.
That might be a good idea.
And now that Mairead has joined us, we'll go over to you if you're ready. So Beretta Painter was appointed to the position of Connecticut State Long-Term Care Ombudsman in May 2018, so she brings a very unique perspective to this conversation. In this role, she promotes and protects quality of life for older adults and individuals with disabilities while overseeing the program's advocacy work. She serves more than 30,000 individuals residing in skilled long-term care nursing facilities, residential care homes, and assisted living residential communities. Ms. Painter has an extensive background working on Connecticut's long-term care continuum as well. Right?
Thank you so much, Nick.
And I'll just remind everyone to speak up. I think we're having a little bit of difficulty with our mic. We're getting some basic comments. So.
But I've never been one to be told I was quiet. So, thank you all for being here today. I can't believe that we're finally here, and this is finally something that we're going to get to see move forward. And Carla, thank you for your story, everybody's stories this morning. We know this is not a partisan bill, right? This is something that everyone has stake in because, as you said, everyone has a family member, a friend, someone in our lives who is impacted by healthcare. I thought your point about going to the hospital, we heard from so many people that once they got to the hospital, they could actually see their loved ones. Some people were hoping that their loved ones got sent to the hospital so they could finally see them, which seems challenging to digest. A little bit about the Long-Term Care Ombudsman Program. So every state has a Long-Term Care Ombudsman Program, and we work to protect the health, safety, welfare, and rights of residents in long-term care communities. Now, often we'll have concerns come in, but we represent those rights from the perspective of the resident. So we need to go and talk with the resident. We need to find out how they're doing, what their needs are. And we also were not able to get in. This bill provides residents or their representative the ability to designate 2 individuals who can provide care and support as directed by the resident or their representative during any public health emergency. It's vital that we recognize the critical role and additional layer of support that is provided for overall well-being of residents. For more than a year, this critical need was overridden by a medical response that focused solely on infection control measures. Residents and facilities were isolated in their rooms and separated from their greater support system, causing untold emotional, psychological, and physical losses. Residents told us that they felt CMS was only focusing on keeping the COVID numbers down, and that this approach failed to provide for their other medical concerns and meet their social and emotional needs. So in Connecticut, we're unique. We have an executive board of presidents of resident council. So I have residents who come and help set up my legislative agenda, to help me find out what's important for them, to have me promote. And so we were getting feedback from them regularly. I also started doing Facebook Live 3 nights a week, and then went to once a week because it got to be a lot. But from that, we had the ability to connect to some residents in these long-term care communities as well as families. And so that's where we were getting a lot of our input and finding out exactly what was happening, and also being able to watch the residents change in their abilities. We've all heard the heartbreaking reports about the loss of life in long-term care directly related to who had COVID and passed away. But we've not heard about the residents who we lost due to the unintended consequences of these restrictions. I don't believe these restrictions were ever meant to have unintended consequences or that individuals at CMS didn't care. Of course they care. They just see things in a different way. They see things very medical, and they thought that they were protecting, and as you said this morning, Charlie, protecting so much that it did cause harm, right? Overprotecting. And the impact of all of that. Long-term care staff were calling us regularly, begging for help. They wanted to provide for each resident and wanted to give the highest level of care, but that was impossible. I don't believe that anyone in the general public can understand the care and support that has always been supplemented by family and friends in our long-term care communities. I just think it's something that is there. We've always had it, so no one's ever questioned it. Without these additional essential supports, many residents, many with the highest needs, received only the bare minimum or just went without some of their needs even being able to be addressed. Traditional staffing levels were in place prior to the pandemic, but now were grossly inadequate. Residents were isolated in their rooms and needed one-on-one time. Many had needs that increased due to the weeks of confinement and lack of movement. The people who knew them and could have supported them had no access, and there was little to no staff available to supplement those gaps. We know that there's a staffing shortage throughout the country, and we're trying to find ways to do workforce development and bring people into this field and honor the people who do this work. Explaining these restrictions to individuals experiencing memory loss, having anxiety, dealing with mental health concerns was virtually impossible. Essential components of their daily lives were suddenly cut off, and the effects were devastating and even life-threatening. Residents suffered significant loss of function, exhibited symptoms of failure to thrive, and lost the ability to walk, use the bathroom, or even communicate in some cases. Yes, there were other ways to communicate with residents that were identified, but we quickly saw that there was no substitute for true human contact. Electronic devices, telephones, and window visits were put in place to address social and emotional needs. Although this took months to get started and was totally dependent on the staff having time to support such interactions. Time from the staff that were trying to work already to meet individualized needs and higher acuity levels. Compassionate care visits. Great idea, but initially was only for very end of life. Who determines end of life? How do you know when end of life is coming? I know some practitioners that were quite upset that they didn't catch it in time. They didn't know how far the family was going to have to drive, and the individual passed away alone. Compassionate care visits later morphed into something where you could have one if the nursing home designated that the resident needed it. Why the nursing home had to decide that versus a resident saying they needed it, I had trouble comprehending. This medical-only approach required strict isolation, and while trying to protect residents from the virus, they denied them their basic human rights and caused devastating harm. Bill 3733 would ensure that in the future, if there is another health emergency under Section 319, residents will always have access to their designated essential caregivers in a manner consistent with all applicable health and safety protocols. I've been asked why we need essential caregivers, right? We have the 1987 Federal Bill of Nursing Home Reform Law. That's in place, right? Why do we need this? Well, residents always have had the right to visitors any time of their choosing, 24 hours a day, 7 days a week. As long as it didn't impact other residents negatively, go to a lounge or another area. But we saw that that could be waived by CMS. Now, again, to protect them from the virus. So I want to be clear on that. I don't think it was ill intent. I think there was things that happened because we weren't really listening to the whole person. This bill also protects residents living in settings not covered under nursing home reform, whose rights were also impacted by the pandemic and sort of this overarching need to feel like we're protecting people we see as having a diagnosis that makes them needy. This bill honors the fact that residents who choose to receive their long-term services and supports in a long-term care community do so with the understanding that they are not giving up their civil rights or constitutional freedoms. This is just a setting where they've decided to receive this level of support and is required to maintain their well-being. I've also been asked how this bill provides for the safety concerns related to infection controls, the staff, or suspected abuse and neglect. Both concerns are already addressed as part of the residents' rights, and this bill does not change the way that that is addressed. All visitation is subject to reasonable clinical and safety restrictions, but the facility must provide reasonable access, and they must have written policies and procedures covering visitation rights, including clinical, necessary, reasonable restrictions and limitations due to safety concerns. This must be outlined and said when it's going to apply. The bill further protects the rights of residents and their representatives to identify and designate who is an essential component of their care and their overall well-being. We need to see residents as individuals with choice and freedoms and decide when and who is best for them, because it's not about their age, their diagnosis, or the setting they choose to live in. I want to thank you all for being here today and for really making this a priority, and I'm happy to answer if there's any questions you might have.
Thank you, Greg. And now, what this group up here too, they are all from New York, Illinois, Texas. They're a diverse group that's been really on the ground, charging ahead in their own state legislatures to make changes, because it's not just a federal issue, it's also a state one. And so in Illinois, Carrie Leljedal has been leading the charge in Illinois. So Carrie's advocacy began with her son, Mairead, a 33-year-old resident of an intermediate care facility for adults with developmental disabilities. Her work as a volunteer advocate in the COVID-19 lockdown and long-term care homes led her to become the Illinois Caregivers for Compromised state spokesperson and family advocate. Together with her team of volunteers, she has worked with the Illinois Department of Public Health, the Illinois Ombudsman Program, Illinois AARP, and state legislators to write essential caregiver legislation in Illinois. The resolution passed in both the House and Senate unanimously, and I imagine was signed into law, but hopefully you can update us on that. So Carrie, over to you.
So like Nick said, my story's different. It's my 33-year-old son. He was born with a rare seizure disorder called Sturge-Weber syndrome. And first, when you have an orphan disease, you spend a lot of time just trying to get people to help, because the doctors, even when he was born, didn't really know what we were doing. At 16 years old, we had to disconnect the entire right hemisphere of his brain to go from life-threatening seizures to controllable seizures. We've done 2 other procedures since then. August 1st will be 8 years since we moved him into the facility he lives in. And I was very lucky when we had to move him there. We were able to find a facility at that time that was less than 10 miles from my house. I was devastated that I had to move him. The state of Illinois cut out my in-home care funding because I had had a heart attack, and they said I was unable to care for him any longer. So to find somewhere close was incredible. Today, 6 months or 8 months prior to the pandemic, my husband and I bought a house literally less than 1,000 yards from my son's facility. I've been hands-on since my son moved in that building, and hands-on means, oh, mom's awake, it's 2 o'clock in the morning, who's gonna show up in the building? Or he calls, Mom, I can't sleep, something's wrong. I'd go over. There's lots of times I'd go over late at night to help put him to sleep, because most of the residents were already in bed, and he likes nights. So it was one-on-one time with him, but it was also one-on-one time with the staff. Every one of us build a relationship with the staff that is in our buildings. One of them had my son out this afternoon because my son lives in the real world. He's 33. He was out finishing tattoo number 6 this afternoon. And so I texted the person that was with him, and I'm like, okay, number 3, son, please make sure you send me pictures today. During the pandemic, like I said, I lived less than 1,000 yards from the facility. Staff members would stop by my house. I would give him things to take to him. He would send things back to me through them. I had a luxury a lot of people didn't have. But at the same time, had my son been in this condition 15 years earlier, and we were in a pandemic, I would not have been able to see my 15-year-old son. Or the families that I've talked to that couldn't see their 2-year-old child who is on a vent and requires more care than can be at home. People in this country don't realize this is not just the elderly. This is children all over the country. Between the various kinds of pediatric residential facilities there are in this country, there's almost 500 of them. They were locked out too. Adults with developmental disabilities, whether they go into a 4-bed group home or they're in a larger ICF like my son is, and ours isn't that large, we're only 49 residents. People like my son can spend 50, 60 years living in residential care. You took away their lifeline. Not you, CMS took away their lifeline. They took away their respect, their dignity. These are people that have spent every day of their life trying to prove who they are because people see the diagnosis and don't see them. My son is a Spitfire. He believes in shock value. He loves to get people's attention, and he doesn't care what he has to do it. I was over 4 months without physically, in person, laying eyes on him. The first couple times I got to see him was only because he had doctor visits, and I was told I had to stay 6 feet away, or when he went back, he would go into a stricter quarantine. So here you are going to the doctor with your son who you haven't seen in that many months, and you're not even allowed to give him a hug. I finally said enough. I figured out what it was going to take to bring him home for a long weekend. And I had to explain to him, we can bring you home, but you have to go into 14-day quarantine by yourself to go back. And thank God he understands, and we did it. Seriously, when they brought him out to me in the parking lot so I could finally see him, I was so hysterical the nurses thought I was going to hyperventilate because I could finally touch my son. In 2007 to 2008, I watched my son lay on a ventilator for 2 months, seizing almost non-controllably. I've done everything I can to fight to save his life, to keep him alive. And what he just went through is not a life. I didn't keep him alive to imprison him. We have to fight. We have to have this bill passed. My son could live in a facility another 50 years, and he cannot go through this again, and neither can his mother.
Carrie. And I think Carrie raises also an important point. When we talk about this issue, we think of nursing homes and seniors, but it also affects children and older adults with developmental disabilities and a spectrum of other illnesses. And I hope we can talk more about that later too. All right, next, Tracy Alvino. So Tracy is a school teacher from West Babylon, and the assistant director of Voices for Seniors. Voices for Seniors was founded by 2 sisters, Vivian Zayas, who's here with us today, and Alexa Rivera. Their heartbreaking journey began the day that their mother died unexpectedly in a Long Island nursing home. Anna Martinez, who was due to be released, suffered under the care of that nursing home after contracting COVID-19. Vivian and Alexa were told she was healthy and safe, when all the while she was clinging to life, struggling to breathe. And so their mother's untimely death has fueled their tireless efforts to hold healthcare workers and government officials like us accountable and pursue real change so that no senior or family will have to endure the pain that they did. So thank you for being here, Vivian and Tracy. I'll turn it over to you.
Thank you. Governor Cuomo called his handling of the coronavirus beautiful. Being lied to by the nursing home staff wasn't beautiful. My dad being placed on a ventilator wasn't beautiful. My brother sleeping in the hospital parking lot just so he could be close to my dad wasn't beautiful. Standing by helpless while my dad's organs failed one by one, that wasn't beautiful either. Making the decision to take my dad off the ventilator wasn't beautiful. My father dying all alone wasn't beautiful. Thousands of senior citizens dying preventable deaths wasn't beautiful. And nothing that happened to any of these families represented here today was beautiful. Our governor in New York, Andrew Cuomo, protests that we are politically motivated, but that couldn't be further from the truth. Our group, Voices for Seniors, are different ages, races, genders, religions, and a million political ideologies. We stand together united in our quest for answers, accountability, and reform. Democrats died, Republicans died, and those whose only worry was the New York Islanders died. There's nothing political about the mass murder of thousands of senior citizens. So it's refreshing to come here and see both sides of the aisle come together for the Essential Caregivers Act. And we want to thank Congresswoman Tenney for meeting with us and allowing us to contribute. And we thank all the other legislators and all the other advocates for their hard work. We also express our sincerest condolences to all the other families that are here today. My father, Daniel Alvino, was placed in a New York nursing home for rehabilitation after neck surgery. He was only 76. He was a really healthy man. On March 25th, Governor Cuomo mandated COVID-positive patients back into nursing facilities all over the state, which turned nursing homes into COVID death chambers. The nursing home flat out lied to us while my dad's condition deteriorated. And on April 14th, my father died from COVID pneumonia. I had to make the decision over the phone to discontinue his ventilator with a doctor I didn't know, couldn't recognize his face, never saw him, just spoke to him. And I wouldn't wish that on my worst enemy. My dad died alone, and sadly my story is one of thousands. I'd like to share a social media post that I wrote on June 25th, 2020. My family has tried everything, begging, pleading, attorneys, legislators, and we cannot get into the nursing home to see my grandmother. Can anyone help us? She is dying and we are running out of time. I know what hell is because I've lived in it these last few months. You see, my situation is unique. Not only did I lose my father to COVID that he contracted in a nursing home, but my grandmother was locked away for 4 months in isolation, and she died of failure to thrive, July 2020. Now, I'm named after her, and I don't think it's a coincidence that I'm here speaking to you today on what would have been her 98th birthday. I really believe that. We were robbed of 4 precious months with her, and she could have spent her last days on earth knowing how truly loved she was. I can't get that time back, but I'm sure she knows now how hard I fought to see her. In our state, senior citizens were sentenced to death with the stroke of a pen, but now with the stroke of a pen, we can save lives. I'm imploring every legislator to get on board. This is a no-brainer. It doesn't cost you a thing. Support the Essential Caregiver Act to change the future. We can ensure that our seniors are protected, respected, and treated with dignity. This will not be the last pandemic, and we must right the grievous wrongs committed during this one. Please, I'm begging you, do not let the lives lost be in vain. Please honor the memory of my father, my grandmother, and all the family members, the tens of thousands of them throughout the United States. Family is essential. What kind of society would we be if we allowed this to continue? What kind of society would we be if we don't fix this? Our seniors trusted us to care for them, and we failed them miserably. We cannot fail them again. We have a responsibility to learn what went wrong during this pandemic that caused so many preventable deaths. So on behalf of 5,000 members of Voices for Seniors, I call on legislators to pass the Essential Caregivers Act. And also, since I have your attention, please investigate the nursing home response in New York and every other state that followed Governor Cuomo's fatally flawed mandates. It's necessary to learn what went wrong so it's never repeated. Please, let's become a proactive nation instead of a reactive one. Thank you, and God bless everybody here today.
And last but certainly not least, Mary Nichols, who has been leading the charge in Texas. So Mary began petitioning Texas in June of 2020 for essential caregivers and formed Texas Caregivers for Compromise.
what do I do with this?
Mairead and her group also worked with legislators to develop the Texas Essential Caregivers Statute, the Texas Constitution Amendment passed in 2020.
We'll try that. Hang on, I'm still working. All right. Thank God I didn't go after Carrie because I was over here bawling like a baby. Okay.
So here, just so you can see, they were listening to me, they sent me the picture of a 90% done tattoo. Sorry.
It's all right. I got no tattoos to show off. All right. So in addition to visitation, I mean, we talk about being visitors. Visitors ensure more than just their social well-being. Visitors enter these buildings, and we are also, as family members, the ones who protect other rights. During this pandemic, residents lost a lot of rights that have nothing to do with visitation, but are also addressed in that 1987 Nursing Home Reform Act. Residents lost rights to do things like use their own property. They lost the right to receive mail. They lost the right to vote. They lost the right to choose their own doctor, to wear their own clothes, to talk to their attorney, to make medical decisions. Their families didn't get care plan meetings. They lost the right to privacy. They couldn't have private phone calls. They were having, these virtual meetings, and there was no privacy anymore. They lost the right to refuse treatments. They were getting treatments without families being consulted, and those who were unable to make those decisions on their own, their legal representatives weren't making those decisions. This is more than just visitation. We had residents who lost the right to practice their own religion, and it wasn't just because their preachers weren't allowed to come in. I had a man, a devout Muslim man, who was not allowed to get on the floor and pray because the family was not able to come in and sanitize his mat, and the staff did not have time to sanitize his mats and floor. Who's okay with that? This is not okay. There are more rights at stake here than just visitation, and I'm all about visitation. That's what I've lived and breathed for 15 months. But this is not just about visitation. We as essential caregivers have protected their other rights, and the main one we have protected is their right for protection from abuse and neglect. And you've already heard about that, so I'm not even going to go into that one. But we are the ones who check on their hydration and the cleanliness of where they live. We look for their lost hearing aid batteries. We replace all of their toys and their clothing, and we do those unpleasant grooming things that the staff doesn't want to do. We do that stuff. We clean their ears. We trim their nose hairs. We clip their nails. We clean the gunk underneath their toes. We do all that nasty stuff that did not get done for 15 months and that resulted in infections and resulted in sores and things that would not have happened had we been in there and been able to either do those things ourselves or spot them and notify a staff member that there was a deficiency. But we weren't there, and so they were neglected by our absence, not on purpose, but because we weren't there. We were the ones that were shielding and protecting them, and once that shield was removed, now they were vulnerable. But they lost all kinds of rights besides just visitation. Texas added essential caregivers to their emergency rules last September, and I don't want to make this sound easy. Our group had to petition our state. We did a lot of work. I even brought our book. We published a book. We held rallies. We published a book called Saving Them to Death. And in our book are stories of our families. Actually, one of our senators held up this book and read from it when she presented our Senate bill to the Senate, our Senate Bill 25, which made essential caregivers statutory law in Texas. But what about all the other states? So let me tell you, there are states like, there are many states that haven't addressed them at all, but there are states like Minnesota, whose Department of Health has put essential caregiver guidelines in place, but they are optional. The facility gets to decide whether they want to participate or not. Now keep in mind, this is a federally guaranteed right, and the facility gets to choose whether they want to give that right to a resident or not. There are other states, like Kentucky, where they've worked on it and that legislation has failed and now they've got to wait for another legislative session. And then there are states like New York, and we've attacked New York a lot, but let's talk about New York. They put essential caregiver guidelines into a statute. Yay! But wait a minute. The Department of Health established guidelines under that statute, which we're all going to do. They need to do that. We're going to put clarifications and specifics in there. If my mother lived in New York and I lived in New York, their facility could decide that her quality of life would not benefit enough for me to visit her, and therefore I was not qualified to be her essential caregiver and she did not deserve one or merit one. Furthermore, their guidelines provide that if they think an essential caregiver is going to cause mental or psychological harm to a resident, they can deny that resident essential caregiver visits. What mental injured resident, what person with dementia, what person with Alzheimer's does not have outbursts? And especially during the pandemic, even those that did not have intellectual disabilities or dementia, how many didn't bang on the window and scream and cry and demand that you come in? That could be considered mental or psychological harm, so no visit for you. They have that right. Facilities have the right to make that decision in New York. Of course my mother is never going to get better. She has Alzheimer's, and that's called discrimination. If every Alzheimer's patient is subject to possibly not getting a right guaranteed to everybody else in the state. A facility in North Carolina right now today only allows 20 minutes outdoors once a week. And that's not just limited to North Carolina. That's throughout the country. There are facilities that only allow 20 minutes once a week, and across the street is a facility that has open visitation. Some facilities say they're following CMS guidelines, but it's based on their own interpretation of what those guidelines say. It is visitation in the United States right now is discretionary, and a lot of those discretions are violations of established rights and of ADA requirements. HR 3733 provides equal access to a support person. Most importantly, it acknowledges that we have 21st century issues. There is a pandemic. We all recognize that that was a danger, but it also affirms a resident's right to not just a visitor, but all those rights in that 1987 Nursing Home Reform Act. It also gives states, it's broad enough, it gives states the flexibility to adopt more prescriptive rules underneath that if they so choose. It also gives them the ability for their health authorities to write more prescriptive rules if they so choose, and they will and they should. No two states are alike, and the states should have the ability to customize this to suit their particular state. So they do have the ability to do that, and most importantly, those health authorities need the ability to amend those based on the severity and the duration of whatever that health emergency is at the time. What if it's only 30 days? What if it's 6 months? We don't want something in place forever and ever when it's only necessary for 30 days. In 1942, the United States committed an atrocious corporate violation of American civil rights when, in the interest of the nation's safety, they isolated 120,000 Japanese Americans in a misguided attempt to prevent espionage on American shores. This was a 20th century violation of American civil rights that I never thought I would see again. In the 21st century, the crisis is health and not war. The risk has not been measured by a person's race or heritage in this situation, but by their disease and their broken bodies, and whether or not they require congregate care to survive. And if they do, then they have to accept whatever crumbs of rights we decide to throw them. Every life, even a broken one, has value and has purpose. Nobody argues that infection control is of the highest priority in long-term care facilities. But also nobody has a more vested interest in the health and safety of residents in long-term care than family members. In Texas, let me just tell you, in Texas we have 1,210 nursing facilities, 2,026 assisted living facilities, and 788 intermediate care facilities for individuals with intellectual disabilities. That's a lot of facilities. That's over 130,000 people living in long-term care. And while we have documented hundreds of staff members who have brought disease into our facilities, we have documented since September 24th of 2020, one essential caregiver out of 120,000 people in long-term care and essential caregivers being allowed to visit for the last 10 months. One brought disease in. That demonstrates how important infection control is to family members and the high priority we put on the health and safety of residents in those facilities. In Texas, we have listened to the cries of our people, but it can't be one state. We can't do this in just one state. We have to draw a line through this, and we have to provide this right for every person in long-term care. This is not a right that should only be allowed for the person lucky enough to land in the right facility, on the right street, in the right neighborhood, in the right state. This is the United States. We need to listen to the cries of our people and begin correcting this. And HR 3733 is a giant first step.
And I also wanted to note that we did have video presentations from Robin Brandt from National Consumer Voice for Long-Term Quality Care. She's excellent in video. We're having technical difficulties.
Oh no. Oh no.
But I will send them to everybody who RSVP'd for this, and we'll post
Okay.
them. And also Vince Pierce, who I've heard the tremendous force for reform and a great voice. And I'm sorry, we'll send that around and share it with you. So we do have time for questions. I have some, but I'd like to open it up to the room if anyone has questions that they'd like to ask. And if not, I'm happy to get all. She's a plant.
Shock. I'm so shocked.
No, I always have questions. And I'll always have questions. The public health emergency. What designates when, are we still in it? Is it a federal designation? Is it a state designation? And if anybody can address that for us, I would be very grateful. And if there's anything that we can anticipate in calling it N, where is this? Where's it coming from? And where will it end?
It's a federal designation, and I think they've said it's going at least through the end of the calendar year. I mean, it's just still going.
Okay.
And as a result of that public health emergency, so many rights just got lifted. Things that would have required a change in the law, regulations,
Right.
they just, poof, they're gone.
And can you talk about how that's done at the federal level, what agency,
Health and
and how?
Human Services.
I think the,
It's HHS, Health and Human Services, the secretary.
Sure, by that building today, I think we need to make a stop there.
I tell you, don't give Carla your address.
That's something we can find. We like colored envelopes. We can make that happen.
Building off of your question, I'm curious from where everybody is coming from, given that the public health emergency still is technically in effect, what are the conditions on the ground in the facilities where your loved ones are? Have things changed? Have they improved? Or are you still struggling to get consistent?
So can I give you Illinois, because I got great, so obviously we're a large state, it truly depends where you're sitting,
right.
what county you're in, what facility you're in. I've been not just advocating and fighting, I wanted to make sure that when I went up against a facility to help a family member, I knew what I was doing. I had taken all the Ombudsman training on my own time. I don't work for the Ombudsman program, I don't volunteer for the Ombudsman program, but I have the education, and I did it on purpose. I tracked for 1 month how many new families could contact me asking for help. From Memorial Day until last Thursday, when our state had their long-term advisory board meeting, which I've now become a permanent pain in their side. I tracked 34 new families that found me through Facebook. So how many people don't know we exist, don't know how to find me, don't know how to ask for help. I still have families calling me that their dad just died, we were allowed 1 hour, and then we were told we had to leave. Some facilities, lots of facilities are 15-minute visits, 20-minute visits, Monday through Friday from 8 to 4. No, we don't do weekend visits, we don't have time, we don't have the staff. Very clearly in CMS guidance, it says the staff is not the condition to visitation. Visitation is based off of residential rights. We are supposed to be providing person-centered care. And I'm going to give you an example. So my son had a very long seizure on Saturday. It happens. He's fine. I have a great relationship with this facility. So they called me. I wasn't scheduled for a visit on Saturday, and I still have to call and make an appointment because they're following the rules, and okay. And I said to the nurses, I will be there in 5 minutes. I'm sure, I'm like, who's the supervisor? They're like, she's not here yet. I said, well, I'll be there in 5 minutes. If somebody can let me in, she's like, that's fine. We'll let you in. And we wound up being sent out to a hospital. Had I been in half of the other facilities in Illinois, I would have been told, go meet him in the emergency room. But no, they let me in. I was there when the paramedics came, which wound up being a very good thing because our local paramedics, I live in a town of 7,500. Our local paramedics were out. They got paramedics from another town. These guys didn't know my son. Ours do. What would have happened if this was a serious seizure and I couldn't have gotten in and I was told I had to wait to meet him at the hospital that is 40 miles away in another state on a bridge that's under construction. And I was very lucky that I got in and I could assess them and I knew we were okay.
Did anyone else from New York or Texas? Yeah.
I would like to say a couple things. In New York, nobody knows what's going on. Okay, so we have homes that are very eager to accept you in to visit. Some have uncontrollable requests. Like, okay, you can see your loved one outside with mask, 6 feet apart, for 20 minutes. Others, you know, you're escorted in and you can hug and you can bring your grandchild too. Okay, those are good things. So I'm very different. We're on opposite ends of the spectrum in the same town, in the same state. It's crazy. And I just quickly want to share this. This happened today from one of my members. The nursing home just called me and told me my mom has to quarantine in her room, no visitors until, now mind you, today's June 30th, July 17th, because she refuses to get a COVID test. This is a woman who has been vaccinated. Hold up, it gets better. I can't believe with them opening up, they're still doing this, and it wasn't even a visitor. It was a staff member who isn't even on her floor or cared for her. Why in this time would she be quarantined for 19 days? I'm going out of my mind. Now they're saying July 21st. So, New York. Nobody knows what they're doing. I can't help her today. Tomorrow when I get home, I will call that facility. And I will set them straight, as I have done, and I continue to do in New York. And not just in Utica, New Hartford, or Clinton. I do it in everywhere. Buffalo. I don't even know some of the places that I've called, but I don't, but I do it. I pick up the phone, and I introduce myself as to who I am and who I represent. And guess what? Every facility knows who I am.
Oh, yeah.
Imagine that.
Of course they do.
And I have been 98% successful in getting these people in to see their family members. Not 100%. One other quick thing I want to share. We are still seeing failure to thrive death.
Yeah.
Still. Unacceptable. So unacceptable. Nobody needs to die from failure to thrive today, or neglect, and especially not abuse. So I know from New York, nobody knows the direction they're in.
Can I just say something about this? The statement that I read to you, I always put a lot of footnotes. So I have some copies if people are interested. The CMS's position from March 2021, when they reversed their ban, they kept changing it during the course of the year, trying to explain, well, compassionate care doesn't really just mean the end of life, it means other things. CMS never acknowledged essential caregiver, but they did have compassionate care and they changed it. March of this year, they said the presumption is people have the right to have visitors. It's a complete change. But what we hear, what the advocates hear, is that sometimes corporations say it's our policy that we're not allowing visitors. We don't care what anybody says, the state or anybody. One thing I would suggest you do is certainly get this guidance, look at the guidance, but file complaints with the state health department and with CMS. We need them to know what is going on, and we need CMS to go out and do surveys and say, this can't be. You have to follow the rules. The rules are families can be in facilities now.
Could I add to that, Toby?
Yeah?
So I did it. I went all the way to the top of CMS.
Yes?
I have a family member in my state. Her uncle passed away on March 30th. After that guidance came out, they were called on the day of her uncle's death, and they were told they could have their compassionate care visit, because he's not gonna make it through the day. They had been requesting compassionate care for 6 months and turned down. They got there, after 28 minutes, they were told, you have 2 minutes and you must leave.
And they escorted them out.
And they escorted them. On top of this, it gets better. We were on a public Zoom call with the Ombudsman program and public health, which this girl got the phone call. So they all knew what was going on.
And they did nothing.
We have filed 2 complaints with the state and CMS. I put in a Freedom of Information Act request, and I still can't get the information, because they were in compliance.
In New York,
Not in compliance.
I filed a complaint with the New York State Department of Health in 2019. They still haven't gotten to it yet, they're backlogged. So this is where a lot of people fear the retaliation of a nursing home, the retaliation of the New York State Department of Health really not caring, not acknowledging, and not responding in a timely way. So there's a lot of stuff going on. The people have fear that their loved ones in these nursing homes and long-term care facilities are going to get worse for them. That's a problem.
So we have a couple of questions, but Mary, did you want to add?
I wanted to just discuss visitation in Texas. We're still under emergency guidelines. Our statute doesn't take place until September 1. At that point, Texas Health and Human Services will put permanent guidelines in place, but right now we're still under emergency visitation guidelines, and facilities must follow both those, and nursing facilities and intermediate care that get Medicaid, Medicare must also follow the CMS guidelines. But one of the biggest problems we have had recently is the appointments. Appointments are not supposed to be used to restrict visitation, but they are. The purpose behind the appointments is so that facilities will know how many people are in their building. It's an infection control thing. It is not a visitation control thing. But what we have are facilities that are still limiting visitation, certain visits, certain numbers of days. And while visitation in Texas is actually more open and well regulated, and I'm not addressing the good actors, we do still have bad actors that are doing this. And even the good actors, their good intentions are going bad. And I'm going to use my own mom's facility as an example. They use an app to schedule visits because that's how they know. There's usually 60 visits in a day that are allowed. But this is a problem because the app automatically shuts down at a certain time. And you have to schedule that visit a day in advance. Is that 24 hours? Does that end at 5 o'clock? When does that end? So Friday I tried to schedule a visit to see my mother Saturday. Oh, I missed that cutoff. So I tried to schedule it Saturday for Sunday. I couldn't schedule it Saturday because we had a family event going on and my sister's mother-in-law had just died. So the timing didn't work where I could just set a standing appointment. Couldn't schedule it for Saturday. Tried to do it Sunday. Couldn't do it for Sunday. couldn't do it before I got on a plane to come here. I will have gone an entire week without seeing my mother, all because of an app. So while it was not an intentional thing, and it is something they're trying to do, to just keep an eye on the number of people in there, the regulations that are in place do, as we've mentioned several times here, have unintended consequences. And if the pandemic is waning, if we are all vaccinated, and all residents in my mother's facility are, most family members, I don't actually know a family member that's not vaccinated. I know that our staff vaccination's at only about 50%, but I don't actually know any family members not vaccinated. So if we're all vaccinated, and CMS says that we can go in there, and CMS says that scheduling is not to be used as a hindrance for visitation, then I don't understand why we're still making appointments. See if I can get through this. In March, I lost my stepfather, who was father to me for 51 of my 58 years. Like I said, we're still under emergency visitation guidelines here in Texas. He passed away on March 24th. March 24th is the day that the guidelines changed in Texas that would allow, it changed the definition of an end-of-life visit. Had it changed a few days earlier, we would not have been living in the parking lot and sleeping in our cars, because we were not allowed end-of-life visits until he was actively dying. But March 24th, Texas changed the definition of end-of-lives, and we owed that to our Ombudsman, and I'm going to say it. Hi, Patty. Patty Ducaye, our Texas long-term care Ombudsman, actually asked for that. And the definition of end of life has now changed in Texas, and it is anybody whose prognosis does not indicate improvement. You don't have to be actively dying. Your prognosis just doesn't indicate improvement, and you're entitled to an end of life visit. And had we gotten that a few days earlier, we would have been able to get in there and see him. And I'll also point out that if that was the definition, of working 12 and 15-hour days with family members calling and calling and calling, asking for help. We should not, as family members, be required to become educated on these very complicated guidelines just so we can hold our dying parent's hand, or just so we can go see our son with an intellectual disorder. That should not be incumbent on us. Our job as a family member, as a caregiver, is to show up in that facility and be a loved one to that person and look out for their best interest. That should be our job. This should not be our job, but this is our job, and we're not going away until it's fixed.
Can I just get to questions, Marie? Or
Yeah.
if you're, unless you keep quick, and I just want to make sure we get to everybody's question.
So I can
Where
tell
were we?
afterwards.
Okay. Sorry, I know you had a question.
Yep, so I'm a former FBI agent, and when we look at, when we investigate things, I was on, for many, many years, I was on the Criminal Enterprise Task Force, also known as Organized Crime. As I learned about how all these clinics work, and, you know, I'm Tracy's boyfriend, our whole family got COVID because Danny was released with COVID without being told that he had COVID, after being lied to that there was nobody in there who had COVID.
They called him a COVID suspect in paperwork.
Right.
Didn't tell us.
Right, so he collapsed, we all got COVID. So as I started looking at this from an investigative standpoint, there's a couple of things that pop out, and as I sit here listening to all these tragic stories and the aggravating circumstances that are still occurring, there's a couple of things from an investigative standpoint that and from a legal standpoint, I can't wrap my head around. For one, I'm hearing the word nurse, doctor, policy, guidelines. These are medical facilities. I'm very interested in Ms. Edelman, about your experience. You talked about the act that was from the 80s.
87.
87, right? My mother, when I was like 10 years old, worked in a nursing home for a period of time. She talked about the horrific things that she saw. This was 40 years ago. Nothing has really changed. So my question is, especially to you, Ms. Edelman, because you've seen a lot over these years, why is these medical facilities not considered medical facilities under the law and governed by the same standards of law as a hospital? Why, if you're putting people in there under the care of people for their health, are they not held to the same standards as somebody that works in a hospital? Some of these people that work in a nursing home are not even as qualified to handle health issues as the people who work in the galley or in the eating facility or in the gift shop in a hospital. How is that legally possible? After all of these years, in 87 when that was passed, when all these things have occurred, all these people know about it, how is it that we are sitting here now, after when this pandemic, people were not even prepared in the hospitals, are we talking about individuals that are locked away and these incredible, not even mistakes, just not really caring, but ultimately the thing that is not getting solved here today, although I do think the Essential Care Act is very important in understanding with Tracy's grandma how important it is to have somebody there. How can this be where these facilities are not being considered under the same legal standards as a hospital? It doesn't make any sense to me.
Well, the legal standard is different. It's the nursing home reform law, which amended the Medicare and Medicaid laws and set a standard. What we don't even have in nursing homes, forget doctors, we don't have nurses. We don't have nurses. The federal requirement now is a registered nurse 8 hours a day.
But how do we not have the legal standards after all this time to where their care, that these people are putting their families in there, how is this not legally held to the same standard as any other medical facility? If I go in to a hospital and I contract hepatitis and they secretly let me out to my family and they all contract hepatitis, there's going to be major lawsuits and potential jail time for people. How is it not the case with these facilities that legal proceedings have not gone to make these things this serious? This is a serious question. I mean, you guys, you wouldn't be in this predicament had this been the case.
It's a question of the law.
Anybody else, and I'm surely not the only one ever asked this
Well,
question.
the standards are different for all these different facilities that receive Medicare and Medicaid reimbursement. There are different standards set by federal law. So hospitals have one set of standards. Nursing homes have another set. They're called skilled nursing facilities under Medicare, nursing facilities under Medicaid. There are assisted living facilities where people live that have zero federal standards, none whatsoever. Although COVID has been rampant in those facilities as well. They get a lot of Medicaid money. Home and community-based services goes to assisted living, zero federal standards. So it's a pretty messed up system we have. And it depends upon.
That.
That's next.
Well, this bill at least does say that all these different kinds of facilities have essential caregivers. It's more than just nursing homes, and so that's a positive step. But, we're trying to get nurses around the clock in nursing homes. That seems like a pretty essential step.
Says it in the name, you think they would have it.
You would think. We're very, one of the other issues, we're talking about staff, not enough staff. Staff have been sick, facilities are understaffed. One of the other things that was waived, many things waived, the requirement that nurse aides be trained before they provide care to people. That was one of the essential requirements of the 87 law, that all nurse aides need to be trained and pass a competency test before they can provide care. They can't work more than 4 months.
that requirement for training was waived. And so the nursing home industry came up with a free 8-hour online training course, which a number of states said that's good enough. Now the effort in Congress, there is a bill that says, well, if they had that training or some kind of training, they've been working as an aide, they don't have to take any more training. That is real, that's going backwards. That is not going forwards. We need better trained people. We need them to get better salaries. People coming in getting $9 an hour.
And how much are they making per person that comes in there? $14,000
Yeah.
for a person that comes in there?
You know, the Medicare rate can be over $900 a day. And then they pay the aides $9 an hour, $10. I mean, it's just, you know, where is the money going? It is not going to care.
The big,
I'm sorry.
because I
We'll
could
get
just
to a
keep
couple more
going.
questions. 'Cause I think
Sure.
we could keep going down this.
So reading through the bill, it clarifies that if you were an essential caregiver and you wanted to visit your same mother, you would have to sign a waiver, like giving like away the rights to sue the nursing home for COVID if they contacted COVID. Could that like waiver then be used by say states such as New York, where they send residents with COVID back to the nursing homes? Could that be used as a legal loophole to avoid?
That's not happening.
Right, we had, our governor actually had an immunity clause so that we could not sue the facilities.
That was
So
lifted
that
in
existed.
August.
Yeah.
It was, but it's still in the court system. Well, it's still in the court system, and,
Yes.
you know, Vivian is one of the cases that is going to decide if it's
Absolutely.
retroactive.
I'm suing as well. It's not in the bill. It is not in the bill that
It's
we
not
have
in the
to sign
essential.
a waiver.
Yeah.
It was discussed and it was absolutely not acceptable to us as essential caregivers.
Okay.
You know what? Because being a staff member can walk in there with COVID and it just doesn't make sense.
Yeah.
You can bring in COVID, but if I do, I have to sign a waiver that it's your problem.
Yeah, that's what I was wondering.
So yeah, that's,
Okay.
I don't know where you read that, it's not.
Okay.
There are a lot of states either passed laws or executive orders from the governor granting immunity to healthcare providers. That's pretty prevalent all over the country, but the cases that I've been reading, the courts have not accepted this. They have not accepted immunity. The problem is a lot of people think, well, there's immunity, we can't sue. And lawyers don't file a lot of these lawsuits against nursing homes because the essential way we pay damages in this society is life expectancy and earning capacity. If you're not making a lot of money and you're not going to live a long time, you're not worth a whole lot in our legal system.
What a shame.
Yeah, economic damages, we always compensate. Non-economic, like pain and suffering, there's a lot of tort reform over the years. You're limited to $250,000. The lawyers will say it takes too much time to do
Absolutely
that.
right. I was just told that my mother falling
Right.
because of the nursing home and breaking her femur, rendering her never to walk again, is $100,000. And you know what I said? Well, then let's sue and you keep it because it's not about the money.
Right, well, that's what families always.
Charlie, Charlie time. All right, thank you everybody for being here. Toby, my name's Charlie, I'm from Rhode Island.
Yes.
Nice to meet you. I wanted to say, first of all, I'm psyched to have a couple other guys here. Everyone used to have guys, now I find out I have a fellow investigator. I happen to be a private investigator, and this is an investigations-related question. So when you talk about departments of health being called in for complaints from residents and families, in Rhode Island, we have, my mother's facility, we've had complaints about preventing visitation. We also, as we've just been bought out in the past couple of months, we've had numerous complaints lodged by residents' families over staffing. And I can tell you the Department of Health in Rhode Island, their tactics for investigative techniques. What's your name over there? Your boyfriend? Tracy?
John.
John, Charlie. Great. So their investigative techniques entail, they send out what they call their investigative surveyors, the Rhode Island DOH.
Right.
They go into the facility, and they go in, when they go in for an issue about staffing, they go to the floor, and when the CNAs have recent occasions, they've had 14 or 15 residents they're responsible for during their shift. Not really safe at all. They approach the women, the CNAs, on the floor in front of their bosses and say, hey, I'm Mary Sue from DOH, why don't you come into the library? I'd like to talk to you about the inadequate staffing here. And the girl's got, dirty diapers here, and, lights are flashing, and call buttons, and her boss is 20 yards away from her, and she's like, I can't talk to you right now. Like, I don't want to talk to you. And all her friends are staring at her. It's horrible. And then the other tactic they use with family members, including me, which is just hilariously amusing in a sad way, they'll call family members and they say, hey, we've got a complaint, we've been given your name, we'd like to talk to you. If they get your machine, which has happened in my case, they'll leave a message and they'll say, I'm the DOH surveyor. I got one the other day, it's 12:30, I'm going to be here probably till about 1:15. If you could just call back. They're asking you to call the landline of the facility.
No.
So you call the front desk and say, hey, it's Charlie. They have
No, I don't think so.
And could you patch me through to the landline in the library where the DOH investigator is currently saying, I'd like to talk about, right? So for me, I'm immune to retaliation. I get it every day, I'm fine. But most of the daughters of the residents, they're not going to do that. The CNAs are not going to do that. And then the DOH turns around and say, hey, thanks for the paycheck. We've done all we can. Nobody wants to talk to us. We're not getting any proof. And I said, I've been doing investigations for 30-some years. I said, I was in about week 5 when I figured out if you want to get information from a witness, you have to make the circumstances conducive to them speaking. Do you have any tips for me?
You're right about all of it. I mean, there's the complaint investigators don't know how to investigate complaints. I would also say that one of the other things that was waived at the beginning in March 2020 is surveys. The government was not doing any complaint or standard surveys. You're supposed to do an annual unannounced survey on a 9 to 15 month cycle, but they are predictable. It's the same month every year, so everybody knows when they're coming.
And
That's
all the facilities and you're here.
yeah.
They do, and they come in the morning when you got your top staff on. They don't go in the middle of the night or in that
On the
8
weekend,
to 10 o'clock where they're shoving the people.
They're supposed to.
They're supposed
They're
to.
supposed
They
to. The
don't
Clinton administration, when Bill Clinton did his nursing home initiative in July 1998, he said they have to start surveys 20% on off hours. That means the middle of the night or,
Weekends.
a weekend, some other time. And a survey director said to me, literally, that we had families complaining that there were no staff on weekends. And so we went in 2 a.m. Sunday morning, and they were right. There was no staff. If they don't see it, they don't cite it. And they just don't, they're not investigators. They don't have investigative skills. We've talked about this for decades. They need to have investigative skills. But right now, you should, that's what they need. I talked to one investigator, one surveyor the daughter told me that her father died in the nursing home, and he was in hospice, and she thought, he was in hospice, he was going to die. 6 months later, she was buying pizza, and a nurse came up to her and said, I quit that facility. Your father didn't just die, he was given morphine, but this nurse killed him. The surveyor who was given that complaint, and she came in and talked to me, she said, she was an investigator. She'd been trained at the Medicaid fraud control unit. She figured out that this nurse had actually been giving a lot of morphine to people. Some of these crazy angels of death, they think they're doing people a favor. He killed several people. And he prosecuted this man. But you have to have an investigator. Most crimes are not committed in front of the police. They're not done right then, but real investigators know how to figure out what happened. And she was a real investigator.
Our director of compliance in the state of Illinois to educate the surveyors of what is compassionate care, what is essential. The surveyors don't know the guidance.
Yeah.
It's changed how many times?
Nobody knows the guy.
Right.
We do.
Know the guidance.
We do.
Come on, no.
We know it.
Rules and hours that you get to go in. It's not any of these things. That's, oh my God, I can't stand it.
Can I also add just one quick anecdote? This phrase, unintended consequences, I think the time for that has passed. There's no way anyway any administrator or CEO of a nursing home chain can say, "Oh, I didn't know isolation was bad for people." I don't even know how they could say that. They couldn't have foreseen that back in March a year ago. But certainly in June, July of 2021, you can't keep saying this. The effects of isolation are unintended consequences. They're well established. So
That's true.
Thank you, everybody.
I think what everybody's saying is the same thing. From the first
Mairead,
question. last question. Everyone in this room has the answer.
Yep.
You're all constituents. What's happening right now here for this bill needs to happen globally related to long-term care. For too long, there's very few of us that have worked in long-term care for a long time, which is why we know too many of the rules. But it's a part of society that many people haven't wanted to look at in a long time, haven't taken an interest in, and that there hasn't been any focus on in years. I don't care what level of long-term care, children, disabilities, older adults. People don't want to look at it. We put those people there because we don't want to see it. Until we start including people appropriately as members of our greater society, and not just including them, but demanding that they have the same rights, that they're treated equally, and that they have the same access that you or I would expect to have to anything else, none of this changes. And the only reason why in Connecticut, some of this was heard and moved forward, we have really strong family members. 2 of them are here today. And we worked on a way with, working with AARP to push out to people who their elected officials were and said, you're calling me, call them. They need to hear your stories. Working to allow virtual testimony and accommodation moving forward, which is now a right in Connecticut. Moving forward, never again will someone in a nursing home have a law changed where they have no voice, because they'll be able to virtually testify on that if they want. You all need to use your voices and demand that your elected officials start to hold accountable long-term care communities and value all people in our society, not just the ones who we see in the grocery store, who we chat with when we go to the park, but the people that we haven't seen, and making sure that they are included. And until we do that, everything that's being said here will continue to be said. And you'll struggle with the same problems. That's what makes departments of public health accountable. And I will say, and our state is not perfect, but we are small. And when you have relationships with people, when the guidance changed on visitation, the branch chief for our Department of Public Health came on a Facebook Live, and she committed to calling. If residents called us and said that, or they weren't getting visits, or family weren't getting visits, that if I called her and said, my team's been out, this isn't happening, she now calls, or someone on her team, we call the building and directly resolve that issue in that moment. Unless you can do that, unless you have that level of commitment and pressure, you're not going to move it forward. And that pressure comes from committed family members and residents.
We have a lot of them in the room here today.
Yeah, well, that's for sure.
But not
But
enough.
not
That's
enough
for
in
sure.
the world.
We
But not
need
enough.
every congressman on this bill.
It would show their commitment to the members of our community who we all say we value, and during this pandemic we have, it's shown a light on some of the glaring issues and concerns, and everyone was so mortified, right? We saw this on TV.
Yeah.
Well, now it's time to man up and step up and show up.
Well, especially for all those that are watching
Woman
this,
up.
they can call Nick, he'll tell you guys how to buy this.
All right.
Everybody call Nick.
That's the next step.
You can also
Carla's
go
about to
on
read off his cell phone
house.gov
number.
and type in your
Yeah.
address, and it will tell you who your congressperson is.
But
So
the
you do that,
staffers
and then
want to
you
ask
call.
us questions.
Yeah.
We'll talk to any one of you guys. If you want to ask a question or an answer, how's it working, we'll talk to you. Because that's how you're going to learn what it's really
Well, I
about.
think we guide people every day anyway. I mean, I'm here in Washington, my whole group knows that, and yet they're still texting me because, well, 19 days in quarantine, are you kidding me? We didn't do that when it first happened.
That's not even the COVID rule.
Right.
Even if you have COVID, you only
They
have to have
just
10
make it
days
up.
with no symptoms.
Yeah.
She needs 15 minutes exposure.
We could talk about this all day.
I know. But just to wrap it up, if anyone does have questions either here in the room or joining virtually, please let us know, let Julia know. Call Congresswoman Claudia Tang's office, and we're here as a resource. How many calls have we gotten today from offices everybody's already been to? So your advocacy works.
Good.
And
It does
continue to
matter.
keep it up,
Phone
because
numbers
as soon as
and
they hang up the phone with you, they pick up the phone and call us.
So
So
what do they
Good.
say when they call you?
they have both. What do they say?
They usually ask questions, they want us to bill text.
Okay.
And
So progress but not committed.
yeah, so it's usually that their staffers review it, and then they have to talk to their member.
It's all a process.
Yeah.
And this is a big part of it, educating everybody on the issue. So thank you all for participating. You guys are all
Thank you all.